Welcome back. Here with us on Urban Debate on Mirror Now. India has reported its very first case of new XE variant of coronavirus from Mumbai. Patient is a 50-year-old woman and is fully vaccinated. Patient showed no symptoms after she was detected with XE variant. The woman arrived from South Africa on 10th of February 2022. On arrival in India, she tested negative for COVID. But on 2nd of March, during routine testing, she was tested positive, following which she was quarantined. The samples were then sent to genome sequencing, where XE variant was detected. Let's straight away go across to my colleague Radhika, joining us on the broadcast for more on this. Radhika, good evening. What is the update that you can share with us as far as this case is concerned that was detected in Mumbai? BMC now in its statement saying that the person has recovered completely and there were no major symptoms.
That's right. The person is asymptomatic and has recovered completely, something that the BMC has confirmed to us. In fact, this was a 50-year-old female who had landed from South Africa sometime in February. And at that time, a few weeks later, although she was found negative in it, later when another routine test was conducted, she was found positive. And after which a repeat test that was conducted was negative. However, her sample was sent for genome sequencing, which is something that is done on a regular basis. And of the 230 samples that were tested, one sample, which was of hers, was found to be carrying the XE subvariant. Now, the lady is totally asymptomatic. The RT-PCR test currently is, of course, negative. However, there is, all her contacts are being traced, and also trying to find out if there are contacts of hers who were positive at that time, so that genome sequencing of theirs can also be done. However, after the health ministry at the center said that it may not be XE variant, as the timing and the scheduling, etc., changes, what the BMC has currently confirmed to us is that they have, although the initial test found that it is XE variant in the initial sequencing, there will be another test that will be conducted. So they've decided to go for another round of genomic sequencing to reconfirm whether it is XE variant. So that's the the update that we're getting from BMC, is that once again this particular sample will be sent for genome sequencing just to reconfirm if it was indeed XE variant.
All right, Radhika, appreciate you joining us with all of those details. We'll keep coming back to you for more on the story. Meanwhile, we've got a reaction from BMC Additional Commissioner as well on this particular case. Let's listen in to what the BMC Additional Commissioner had to say.
Our first question is how easy or how difficult it was to achieve this milestone as we become the first megacity to do this?
Yeah, it was indeed a difficult task, but it is possible because of the team effort and because of the active participation of the local leaders. And now we are 100% safe, you can say. We are also targeting the 12 to 17 and to achieve maximum vaccination in this age group in a minimum possible time, and we have planned for that as well.
Any potential threat you're seeing brimming up?
There is a chances of fourth wave, but I mean, we are, as I said, we are fully vaccinated. Even if the fourth wave come, we are ready to take on the fourth wave. Therefore, we are keeping our facilities ready. But we are also presuming that we should not be able to use this facility. The fourth wave may not be of that level because the vaccination is already covered, and the people have realized the use of COVID appropriate behavior. So by and large, they are also following this behavior whenever they go out, whenever they go for the socialization. And this intervention, this support, we feel that there won't be any issue to handle the future waves in case we come across.
And joining us on the broadcast this evening is Dr. Shashank Joshi, member Covid Task Force Maharashtra. We are also joined by Dr. Mohan Gupte, retired founder, director, ICMR Epidemiology. Appreciate both of you joining us here on Urban Debate on Mirror Now this evening. Dr. Shashank Joshi, I want to first talk to you about the new case, which according to BMC was of XE variant of coronavirus. However, sources in the Ministry of Health have suggested that it is too early to say that it is XE variant. What exactly is it in your opinion?
So one thing is very clear-cut, that this case was 1 month old and has fully recovered and gone home. The genomic sequencing lab at Kasturba Hospital, headed by Dr. Jayanti Shastri, in their genome sequencing analysis found that this was an XE variant, which is a recombinant variant of BA1 and BA2. Often when such analysis is done, recombinants can also be contaminants. And therefore, beyond reasonable doubt, to confirm it, the INSAGOG raised a doubt and they want this sample to be reanalyzed. Madam Shastri has sent this sample to NIV, which is the National Reference Lab for Genomic Sequencing, for further analysis. Having said that, this patient has fully recovered. It was an international traveler. It was not an Indian. And therefore, we should be cautious, but there is no need to press a panic button. COVID-appropriate behavior, particularly masking in indoor environments, closed, crowded spaces which are poorly ventilated, because it's an airborne virus, is something important. Also remember that the 600 plus cases from UK, which are XE variants, which are recombinants, they have not been shown, they are being shown to be more contagious like the BA2. So the behavior is very similar to BA2 of Omicron, which is a mild disease. So it's predominantly a nose and throat COVID and not a lung COVID. So that's something, but the vulnerable groups need to take care, like the senior citizens, people who are immunity is compromised. That is all. So we should continue our genomic surveillance and sentinel surveillance throughout for over the next couple of months.
Need to continue genomic surveillance. It's a nose and throat COVID is what you are telling us, Dr. Shashank Joshi. Dr. Mohan Gupte, if you could just help us understand what exactly is this XE coronavirus variant, and how should we really now react? Because as far as Maharashtra is concerned, it has become the first state in the country to even drop the mask mandate. Now, first case of XE variant has been confirmed, even though it came last month. Do you think we need to be now more cautious?
I don't think so. Because this case, as Dr. Shashank Joshi mentioned also, is more than a month old. February, sometime the patient came, was detected to be negative, and sometime in March, the patient was found to be positive. As I find some 2nd of March. So it's more than a month since she has been found positive. She became negative, and she has also been discharged. So I don't think there is anything that we need to really worry about. There are several problems with respect to this XE. This BA1 and BA2 recombinant virus is what we are looking at now. It has got 10% more transmissibility compared to BA2. Given this situation, the transmission possibilities are definitely higher. But it doesn't mean that severity will increase. And what is something happening in UK is not definitely replicable in Indian situation also. We do not know how much the vaccines are going to be useful. This lady was fully vaccinated. I don't have the details about which vaccines she has received, but the vaccines that we are using are essentially Covishield and Covaxin. And we don't have very great details still available about these vaccines, how effective they are going to be against Omicron, BA1, BA2, and definitely against XE also. Now, given this situation, and given that you're going to have always various mutants going to come over a period of time, waves are likely to come. They may not be very serious, because as time passes, the waves are going to be, the disease is going to be comparatively mild. That's what I believe. And given that situation, I don't think we should jump into, again, lockdowns and making masks mandatory and so on and so forth. I would keep a watch and I would go for genomic sequencing, but I don't think we like to go in for the old things that we have been doing at this particular stage of lockdown, making masks compulsory, and putting all kinds of restrictions. We still have to obviously observe hand washing, safe distance, and so on. But beyond that, I won't make several of these things mandatory.
Okay. Dr. Shashank Joshi, now as far as its transmissibility rate is concerned, if it is 10% more transmissible, severity isn't too high, but the way it is wreaking havoc in some parts of the world, what should India's response be, in your opinion, given the fact that the first case has now come to India?
First thing is that this variant is not causing any havoc. If you see the British report of 600 plus cases, this case, again, as I said, and as Dr. Gupte also mentioned, India actually had this BA2 variant, between 15th December to around 30th of January. So whatever is seen in the rest of the world, we already had it. Plus, with a large proportion of our population vaccinated, as well as a large natural exposure both to Delta and Omicron variant, over next 3 to 6 months, I think we are reasonably standing well. We will keep on getting waves. One thing, evolution-wise, when we see viral evolution right from flu pandemic 100 years back, evolution-wise, the strain gets more contagious but less severe or virulent. So the likelihood of it causing severe disease, except for the vulnerable groups, is most unlikely. So I don't think there is any cause for fear or panic. Yes, whenever you need voluntary masking, voluntary vaccination is important. This national was a South African national. In South Africa, the vaccination given is a mRNA vaccine platform, usually a Pfizer or a Johnson, which is not being used in India. So obviously right now, most of the Indians have hybrid immunity, which means most Indians have either been exposed to COVID, either asymptomatically or symptomatically, and have had a large proportion who have got vaccinated. So we have dual immunity, and therefore our sero survey, which is now ongoing by the MCGM, will also reveal what is the degree of protection. Most of the older sero surveys in June done had shown 90% plus antibody prevalence. So obviously, unless and until there is a new variant which is really sinister, it is very unlikely that anything which will happen. One more thing I would like to say, these recombinants we know from HIV days, and they are not very, the ones which can cause major, pandemics. So, that from that standpoint, even in UK, only 600 cases have been diagnosed, and the British data has not been able to suggest that there has been any major threat in terms of virulence, severity, or transmissibility. They have said it is still unknown, and we still need to collect more data. So I think it's work in progress, but I think there is no cause for any fear or concern or panic. Appropriate behavior is all what we need.
Okay, no need to panic. That's the word coming in from both our guests this evening. But Dr. Mohan Gupte, earlier this year, we know IIT Kanpur team had predicted that we are likely to witness the fourth wave of COVID wave in June, and it is likely to continue till October. Now, we know how the second wave and the third wave of COVID pandemic also started with the initial case counts coming from the state of Maharashtra. So, given that sort of a condition, what do you suggest? Should people be wearing masks all the time? Should we now open booster shots for everyone above the age of 18?
See, when it comes to booster shots, WHO has made it very clear that whether you give booster shot or not, you are not going to gain very much higher. As Dr. Shashank Joshi mentioned also, what we are having is both the vaccination as well as natural infection. So given this situation, our population doesn't have to bother really about booster doses. As I've been saying, what we need to think about booster doses will be particularly for those persons who are highly susceptible, old people, those who are having comorbidities, and so on. For those people, and particularly those who are immunocompromised, even 2 doses are not adequate, is well known. And in that situation, for those kinds of people only, which forms a very small component of the total population, we may need to give over and over again vaccination. But beyond that, I will not talk much about booster doses and make it mandatory or recommend it and so on. The way even now, we are getting instructions and intimations from the government side also. They say, if you feel you come for even for the old people, if you feel you can come for the booster dose, it's up to you whether to have the booster dose or not. And I would not say that booster dose is now absolutely essential or anything of that kind. So leave aside the booster. Apart from that, we have seen that tuberculosis is now coming up in a big way, because during the corona time, we perhaps ignored tuberculosis. We have got similar kinds of information for leprosy also. Patients have not been reporting to clinics for treatment and so on. So we don't want to go to that kind of situation again. I don't want to go beyond public health. But in public health, we have seen that various diseases, various vaccination programs have definitely suffered. And we need not go back to that situation again. We should concentrate on various other activities related to health also. So that's what should be our priority. These waves will come and go. and we have to face them. But they are not going to be serious. We have seen and we
Okay.
have learned it through influenza also that we can manage these things very easily. We need not worry about those things.
Okay. Dr. Shashank Joshi, one last question before I let you go. Now, this person had tested positive on 2nd of March. And why is it that the results of genome sequencing have come so late, more than a month after she had tested positive? Is that how genome sequencing is usually done?
Usually the genome sequencing takes time because, it is done in batches. And you know that in the end of February and March, the number of cases drastically reduced. So out of the 238 samples analyzed, most of them were BA2 variants. One sample was the XC variant and one was Kapa. Kapa is still there, Mumbai's original strain. And that has been replaced by the Delta, and the Delta got replaced completely by Omicron, BA2 now. So this, because the number of samples were much less, that is why it took probably a couple of weeks before which the data came out. And that is something which is reasonable. I'm not much majorly worried about it. And as I said, there is no major cause for panic from this isolated case. The case is fully recovered. As I said, she's a foreign national, and there is no cause for alarm.
All right. I think the bottom line is there's no need to panic. That's what the doctors are telling us. Thank you very much, both of you, Dr. Shashank Joshi as well as Dr. Mohan Gupte, for joining us here on Urban Debate on Mirror Now this evening and helping us understand this new case that was detected in Mumbai of XC variant of coronavirus. So no need to panic. That's the word coming in from the doctors.